part of regular good health that we all enjoy is getting to see our doctors from time to time. And one of the things they always say is, I want you to go to the lab and get some tests done. And that means you, in most cases, skip a meal, go in with 8 to 12 hours of fasting, and give them a blood sample and a urine sample, and they say thank you very much, and you go on your way. And then a few days later, your doctor contacts you and says, come in, let's talk about this. This is good, this is bad. You need to do this, you need to do that. Let's try something else to let you know how you're doing health-wise. Well, joining us today is somebody who is an expert in not only blood draws, but blood analysis, is Dr. Thomas Hirose with us today, and we welcome you back to the program, sir. Good to have you with us.
Thank you. Good morning.
One of the components that makes up our blood, along with several hundred other things, is something we call cholesterol. And I remember it used to be that there was a number. You know, if it was 150, if it was good; if it was 250, it was bad.
Yes.
And they'd say your cholesterol is too high, cut down on fatty foods and exercise more, and come back and see me in 6 months.
Yes.
Cholesterol has become a little more sophisticated in our testing now, I understand.
And it has, because strokes and heart attacks are the #1 fatal event in this country. So we've come to learn over the last several decades that we need to look at the components of cholesterol, not only the total number.
Mm-hmm.
So we have good cholesterol and we have bad cholesterol.
Mm-hmm.
And the bad cholesterol is like a dump truck. It takes the fat and it deposits it onto the walls of the blood vessels,
mm-hmm.
causing strokes and heart attack. And that's known as LDL cholesterol.
Mm-hmm. That's that narrowing of the arteries and blood vessels that we hear about. They get smaller and smaller, and then there's a clot, and then
Yes.
things are bad.
That's very bad. And then there's the good cholesterol that actually removes and allows the cells also to be in balance with the cholesterol. That's HDL.
Mm-hmm,
yes.
mm-hmm. So I guess you could say LDL would be the lousy cholesterol, and HDL would be the healthy cholesterol.
That's correct.
You want to remember the letters there.
Yes.
Okay, so the one, I guess the first thing they always say is, you know, cut down on fatty foods, watch your diet, try and lose some weight, and exercise more. And in some cases, that'll do the trick. That'll get that cholesterol in the right zones. Sometimes there's still not there, and they have to do some other things.
Yes, unfortunately, we are a product of our genetics. And what we have learned is that diet and exercise so important, but 1/3 of the population, because of their genetics, require a little bit more. And this is an area that medicine has made a huge inroads.
Mm-hmm.
The statins work so well for that population.
These are some of the drugs, I believe Lipitor is one.
Yes, it is.
And others that some of you folks may be aware of that do a similar thing. And actually, what do they do inside the body chemically?
The challenge with cholesterol is how it's absorbed and how it's transferred to the liver. And in certain genetic combinations, the receptor to bind to the cholesterol and put it in the right location is defective.
Mm-hmm.
And in those patients, 1/3 of the population, they need a medication to help make that balance correct.
Right, and that's what it does. So it makes the cholesterol go where it's supposed to go.
Yes.
And not deposit it inside your blood vessels, basically, is
Yes.
the desired result there. Are there other methods? We hear about things like angioplasty, where they widen out the blood vessels. Is there a similar process available to, for lack of a more medical term, vacuum out the cholesterol?
There is, and that's for the patient whose cholesterol is so extraordinarily high that it must be removed mechanically. It's a procedure known as LDL apheresis, and it's very similar to dialysis. And its application, fortunately, is only to about 1 in 1,000 or 1 in 10,000 patients, where the medications just don't work.
Mm-hmm.
And blood is taken out of one arm. It goes into a machine very similar to a dialysis. It binds to a sugar, it's a dextran, and then the cholesterol is removed and the remaining portion of the blood is returned to the patient.
Okay.
This is done every 2 weeks.
Almost like a filter, I guess, for lack of a more genetic or genteel term for it there.
Yes.
And you say very similar to dialysis.
Yes.
But those are very, very extreme cases.
They are.
Right. We also hear about something called triglycerides.
Yes.
Now that's usually they usually have a total cholesterol, HDL, LDL, and then triglycerides. Now, how's that different from HDL and LDL?
The triglycerides part of the lipid panel, and now we move into the broader category of what's known as the metabolic syndrome. Unfortunately, in our country, because of our lifestyle, more than 50% of the population could stand to lose weight. So there's obesity, and along with that, there's insulin resistance. That's the handling of sugars. And then the third limb of the metabolic syndrome is our inability to handle the lipids.
Mm-hmm.
So it's those three things that create this super category within which strokes and heart attacks are in, the metabolic syndrome. So the triglycerides are a byproduct of the metabolic syndrome. We come to learn that, yes, they do impact longevity and the propensity to have insulin resistance, to keep the obesity going and to eventually develop stroke and heart attack.
Right. So again, that's another component. You won't just see one number anymore. You'll see probably 4: total cholesterol, HDL, LDL, and triglycerides.
And I would like to add one more. We've come to learn
a new one.
Yes, over the last 10 years that there's a subcategory that's not normally tested, and my prediction is that it will be added soon. It's called, the subfraction is called LP(a). And I would highly recommend that patients that have a moderate or high level of cholesterol, and as a part of their management, that they actually measure that value. This is one of the cholesterol components that is ethnically variable. So, for example, Asian Indians or the population that is of Asian heritage, it's a marker of more severe disease where the other numbers may be relatively normal. Yes.
So another test we'll all be hearing about. And then, of course, there's a lot of other things they test in the blood. I know for us guys, they want to check our PSA,
Yes.
Which is an indicator of possible prostate cancer.
A very good screening test.
And there's other things they can check for liver function, other things as well through blood tests. And of course, in your particular practice, specifically people who are on medicines like Coumadin, obviously need that ongoing testing with the faster results than average labs, so they can keep that. If they're on Coumadin, I know you've told us in the past, that's a very delicate balance, just the right amount. So
we need to keep it safe and in the right zone.
right, and that's what you provide as well over your facility here. Thank you for joining us. Good to have you on the program today, explaining a little bit more about what's in our blood and what all those numbers mean on those tests our doctor sent us for every few months. Doctor, thanks for joining us today.
Thank you.
Dr. Thomas Hiroshi, practicing right here in the local community with the Coumadin Clinic. We'll be coming right back with more as our Friday program continues for you right here on Channel 6 TV.
Dr. Mark Morin, retired physician and patient at the Laguna Hills Coumadin Clinic.
Coumadin is a very effective drug and tricky to control.
If you're on Coumadin, you need to be evaluated by a physician every 3 to 4 weeks. We draw blood in the office and have your results in 5 minutes.
I am seen by a real doctor who evaluates, charts, and controls my doses so I can stay healthy, active, and playing tennis. Be smart and in control at the Laguna Hills Coumadin Clinic.